I'm Dr. Teresa Wagner. I work for the University of North Texas Health Science Center and Safer Care, Texas. I started with rural health when Titus Regional Medical Center reached out to us about the issues that they were having with the COVID-19 pandemic.
My name is Teresa Scoggin. I'm the Chief Executive Officer of Titus Regional Medical Center in Mount Pleasant, Texas. Mount Pleasant, Texas is a great place to live. We're 2 hours east of Dallas on I-30. We're 60 miles from Oklahoma, Arkansas, and Louisiana. Northeast Texas is one of the lowest areas of healthcare outcomes in the United States. There's 1.5 million people in Northeast Texas, and if we were a state, we'd be the 40th largest state. However, we'd be 45th for mortality, 48th for heart attack death, and 51st for stroke death. Healthcare literacy is a passion of mine because during COVID, we experienced the inability to communicate to all levels of the community on a daily basis.
The simple definition of health literacy is people's ability to use, find, and first access health information that they can understand and then really apply in their own cultural setting at home. When we first embarked on the project with Titus Regional Medical Center, I really did within my head what we call a needs assessment. So I looked at the situation that was occurring and decided, kind of based on my foundational knowledge of health literacy and health communication, what it was that was lacking in their ability to communicate with the community. And it wasn't just the language barriers, there was the relationships with key leaders in the community, or what we call gatekeepers sometimes.
It's the human touch. It's the relationships that we're trying to develop that are key to great healthcare.
We hired a community health worker. Community health workers are people who live in the community, who know the culture of the community, who may have grown up in the community. So the community health worker that we hired actually grew up in Mount Pleasant. We met with several groups across the community through churches and schools and workplaces to find out what some of the concerns of the community were. Really, some of the key findings were that the Spanish language gap. So even if people were trying to find information about health, there was no Spanish translation on the website, or perhaps even if they called the medical center, there was no one that spoke Spanish, or if they went in for treatment, there was not a Spanish provider or translator available. Other factors were, some discrepancies about payment models, which is a huge health literacy concern. Another topic that came out of the focus groups was compassionate care. So potentially when providers don't understand the language or the culture of their patients, they might not come across as compassionate. So by doing the Health Literacy 101 and the cultural competency trainings, our hope is that there will be a better understanding and an ability to communicate across cultures in a meaningful way. Organizational health literacy speaks to how well organizations help to reach back to the public.
We're looking forward to giving our team members, both physicians and nurses, administration, in all positions from top to bottom, the ability to talk to our patients and talk to the visitors and their family members to ensure that they understand the continuum of care, their care plan, the next steps, and teach them the right way to practice healthcare.
Our goal with health literacy in the rural communities includes not only Titus Regional Medical Center, but we hope to use this as a best practice and reach out to other rural communities that have struggled not only with COVID-19 pandemic, but also with just the health and wellness of their populations.
On behalf of the Board of Managers of Titus Regional Medical Center, our administrations, our physicians, and our community, I want to thank the University of North Texas for this opportunity for us to collaborate and work together to improve health literacy in Northeast Texas.